Morning, everybody, and welcome to this meeting of the Board of Directors of Lincolnshire Partnership NHS Foundation Trust. My name is Kevin Lockyer and I'm the Trust Chair. It is our practice as a board to start our meetings with either a story, either from a patient or from a member of staff. This morning we're hearing from a member of staff. Khalifa is joining us. Nice to see you, Khalifa. Thank you very much for giving up your time this morning. Khalifa's here as one of our recent international recruits. So we're really keen to hear as a board how the experience has been, what we could do differently, what we could do better, and hopefully some things that we might have done well. But it's an absolute privilege to have you here, Khalifa. The floor's yours, and thank you very much for giving up your time.
Thank you so much, Kevin. Thanks for inviting me, everyone. So this morning, I'd just like to touch on the fact that I came over here as an international recruited nurse, in terms of better educating myself and for upward mobility. So I came to learn and I came to perform. And as an international recruit nurse, I can say that the IR program that you all have is brilliant. It is excellent. Yeah, they were very, they helped us a lot in terms of establishing ourselves as UK-based nurses, preparing us for the Nursing and Midwifery Council's examination, and also giving us a little touch of what to expect when we come out actually in the workplace. So for me, back home, there are so much nurses that in terms of upward mobility, it is a slow process. So I was told that come to Lincoln, that you'll be educated, you'll be able to see something new, which is what I wanted. And also Lincoln is a very family-oriented community, and that's where we come from. That's what I'm accustomed to. So I chose to come to Lincoln on that behalf. In terms of coming on the board, it's totally different from being within the IR program because it's fast-paced. We all know that throughout the world there's a nursing shortage in terms of nurses and getting nurses. So when I came to the ward now, the environment was different. I was initially posted to PQ, which is what I'm accustomed to in terms of the fast pace and the settling of patients. But PQ had to temporary close, unfortunately. So I've been redeployed to the Vales, which is a very different environment for me. So it's a learning curve. Each day I'm learning something new. I'm experiencing something I've never experienced before. However, in terms of the support from management and my fellow colleagues, that has been happening. However, because of the constraints and the demand on nurses and staff shortages, it's happening a bit slowly. Yeah, the managers are always there to offer support, especially Anna Black, Rachel Kitchen, Emma Duncan. Sorry. They have been very supportive towards me. In terms of every day, I can get a word of support saying, think of how far you've come, think of the things that you have done, and think of, what you have learned and you have achieved. And I can say in my time of being here, I have been able to learn so much, and I would like to learn more, as I said. Some of the not so good is, I should say, in terms of experiencing the learning part, because we don't have the time to sit down and create that space in which you could learn the different processes. I've been having challenges where that is concerned. And as we know, we have all over the UK, there's a cost of living crisis. So I'm finding it a bit difficult in terms of, managing finances and paying rent, which is something that coming from where I come from, I didn't have to do. Yeah, but I think I've accomplished so much leaving home, leaving what I know to come into the unknown. And I'm starting basically from the bottom, from scratch, leaving home, you have your own home, your own vehicle, you have those things. Coming here, you have to do house shares. You know, I've been able to purchase a vehicle. I'm not very good at driving manual, but I'm learning as we go along. So that's something that I find of a accomplishment for myself. Also, the support, you know, just that everyone is there to give a comforting word. And I do appreciate LPFT for that because, you know, where you're struggling, they ask, do you need the support? And it might not come as immediate as you would want it to, but it does come, you know, in a voice of concern or even a kind word. And I really do appreciate that. So in terms of my story, that's my story.
Khalifa, thank you very much indeed. Now there might be colleagues on the board who want to ask you questions or comment on what you've said, but I'm the chair, so I get to go first. That's one of the few privileges I have. So I'm going to say three things, I think, Khalifa. The first is, you know, thank you for your positive words about how we've helped you to, you know, kind of transition. I don't for a moment underestimate how difficult it must be to leave home, family, friends, and you know, and travel to another country and start again. And I've got the deepest admiration for you for taking that step. I really do. The second thing I want to say is that it's a privilege to have you here. I'm absolutely convinced that the trust is better, stronger, more capable for having you and your international recruit colleagues. So I'm just really pleased you're here. It's a real privilege, not just because you know, you're an extra nurse, but because you bring different experiences and different, you know, different competence to us, and you make us a richer organisation as a result. And the third thing I'd say is if you ever think that there are things that we could do to support you better, then you have a voice and you should use that voice and we will listen. Because the really important thing to me is not just that you get the chance to come here and learn and grow and develop, but we want you to stop here. We want you to stay here for as long as you want to stay here, and we want to make that experience as positive for you as we can.
Thank you.
I think you and your colleagues as international recruits are inspirational, and I'd like you to take that thought away if you don't mind. So I'm going to open it up to board colleagues. I'm going to start with Chris Higgins. Chris.
Morning, Khalifa. Morning, Rachel. Morning. Thank you for sharing your story. That's really, really good to hear. And just say, really pleased to hear that you're getting that management support. That's really vital. You know, that's a kind of makes such a difference, doesn't it? When you know, come to a new trust, and in your case, into a new country, that support that you get is obviously really vital to the experience that you have. So really, really pleased to hear that. My question was really just around. You said about just the opportunities for learning and the time on the ward. I'm just wondering if there's anything from your kind of perspective, if we could do something different there to try to create more opportunities for learning. And if you had any ideas about that.
In terms of what I would have spoken with the managers concerning that, I believe that the suggestion is protected time where learning is concerned, because you feel when you're on the ward and you're expected to perform, and some of the things we may not know. And as I always say, the student nurses have an advantage on that because they would have been taught that from as a foundation. So when we're coming now, you know, is navigating and trying to find different things. So the protected time needed to literally sit down and say, here's what, we're off the ward, this is real, let's navigate it, let's learn the different things. Do you know where to find this? Do you know where to find that? And I think that which was suggested, yeah, will help.
Thank you. Helpful.
Right, sorry about that. I'm having some technical problems. I couldn't unmute my microphone. If you wonder why I was sat here doing nothing. Who have I got next? Amy Beaton. Amy.
Hi, Khalifa.
Hi, Amy.
So I'm Amy Beaton. I'm Director of People. You know me. We've met a few times. So Kevin and Chris have covered some of my comments and questions, so I won't repeat it. The only thing that I will say to the board around Khalifa is she's not only come and made an excellent start in terms of her nursing journey, but Khalifa has been a real advocate for us and has done some videos for us encouraging other nurses to come to the UK, and so we're really grateful to have Khalifa proactively also trying to encourage others to come. And I would also echo, Khalifa, the messages from your other colleagues in terms of reflect on how far you have come. And, you know, I know you've got your Mini and your car and you absolutely on that journey. So, you know, just real well done in terms of that. As I said, Chris covered one of my questions. The other would be from your perspective, obviously you talked about cost of living and managing finance. And so I just wanted to explore with you, what do you feel is missing in that induction package that would be really helpful for you? And that doesn't, you know, necessarily need to be about clinical. Thank you.
So in terms of the induction package that they would have prepared in the IR team, the realism of it, because in terms of those who would have recruited us, they did say that Lincoln is more cost effective, but that's not the reality. That didn't translate when we had to move on from what was provided into us now having to be more independent. That wasn't translated because the reality of the situation is Lincoln is education or university community, and cost of living will be much higher because landlords looking to see how much they can make off of students, you know. So the cost of living part of it could be a bit more realistic, and perhaps finance management. Even though they do discuss it, I think we need to have someone more proactive, or at least probably a financial advisor come in and support the international recruits where that is concerned, because expectations versus reality is a very wide margin right now. So I think perhaps that could help in terms of the other recruits coming in, where their expectations would be met, you know, because they have the actual picture. Yeah, because I think for me, that would have been a blurred, where those who would have recruited, they said, yes, come, it's cheap, it's affordable, but that's not at the end of the day, that's not what's happening. And to be expected, we are going through inflation, and every day there'll be, you know, something new. However, give me the true picture, let me decide. Yeah, I think so. I think that could be added to the package.
That's really helpful. Thank you, Khalifa.
Thanks, Amy. That sounds like a really positive suggestion and something we can probably do something with, I think. Sharon Harvey.
Morning, Khalifa. You haven't met me before. My name's Sharon Harvey. I'm the new Director of Nursing and Quality here at LPFT. I just wanted to say morning and hello. I've got 2 comments and a question, if that's okay. So my comments are just thank you for sharing your story and for the work you're doing and for being so open with us. And I wanted to say thank you to the team that are supporting you. You specifically mentioned Rachel, Emma and Anna. So I know you're here today, Rachel, but thank you. And please pass the thank yous back to the team as well, because I know that you'll be supporting as best you can. My question, Khalifa, if it's okay, was building on Amy's, what advice or recommendation would you have for us as new nurses come into the organisation? So I guess from a clinical perspective, what else could we do to support international nurse recruits as they come in? Thank you.
Okay. In terms of the supporting of international nurses, to touch on more what Chris would have said, we're coming from a clinical perspective. Back where I'm from, we're still handwriting notes. So, you know, the progress of it being computer-based and documentation being done on the computer, we have not gotten there yet. So more in terms of the clinical aspects, I would say that we are a little more stronger because of our background. We have a mix within psychiatric and also general nursing. In terms of how we can be supported, I believe we need to do, yes, the idea is to come and get your PIN so that we can be out here on the ward. However, that third year or final year part of nursing, what our nursing students would have gone through, perhaps we need to look at tailoring something like that for the IR nurses, where they'll be able to navigate real properly. EPMA was, after a few days, it was easier to navigate. However, Rio is a matrix by itself. Yeah, and you know, we have to, in terms of our sectioning, our mental health act, because that is what we are governed by. Yeah, so I guess a little more training where that is concerned, so that you're doing the right thing and not causing any undue harm, right? But I think that perhaps a little bit of the final year program need to be implemented where we are concerned, so that we'll be up to scratch. Because at the end of the day, when you're seen in numbers on the ward, you are expected to perform, and not everybody will understand. We're international nurses coming in, learning as we go along, because nursing is a forever learning process. Yeah, every day is something new. Every day we are breaking barriers when nursing is concerned. So for me, in order to support the IR, I think perhaps tailoring a part of the final year nursing for nursing students here, that might be a bit helpful.
Thank you.
Thanks, Sharon. Tim.
Hi, thanks, Kevin. Welcome both. So my name's Tim Harry and I'm a non-exec director on the board. My question really is around sort of general life, as you might say, rather than maybe specifically around clinical. And I'm interested in terms of preparation for any sort of cultural differences. So I guess my question is, have you been surprised by something in your general sort of living in the community and at work? So is there perhaps more that needs to be done around cultural difference preparation, so you have less surprise? You're never going to cover everything, but you know, is there anything significant that was a bit of a, oh my goodness? Thank you.
I'm sure there may be a lot of culture shocks around us also, coming from the Caribbean. You know, it's just navigating and understanding, because some words, you know, are no-nos here, where it's perfectly fine where I'm from. So in terms of culture shock, for us mostly, I'm not just speaking for myself, food, because Caribbean people, we surround everything around food, you know, celebrations, times of sadness, you know, everything is around that food. So culture shock wise, it was different. Yeah. It was different. So learning to adapt, learning to do without certain things, or learning to add certain things to replace it. I guess yes. And in terms of language, knowing, you know, what certain things mean. Like in the beginning, when I first came, everybody would ask, "Are you all right? Are you all right?" And I was like, "Why do I look like something's wrong? I wonder, am I looking sad? Am I, you know?" And then I realized, "Are you all right?" It's just like saying hi, hello, you know, it's the same, you know. So in terms of culture, it's a learning curve. And with every day you learn something new and you may chuckle to yourself and say, oh boy, I can't believe I said that. Or, you know, I wonder if they were offended by something I said, which I didn't mean anything by.
Yeah.
But other than that, mostly food for us.
Brilliant, thank you. We'll have a conversation about food sometime, because I like cooking and food. Thank you.
Thanks, Tim. That's an excellent question. And you'll be relieved to know, Khalifa, this is the last question. Mark.
Oh, brilliant, excellent. Thanks, Khalifa. Great to meet you. So I'm Mark Platts. I'm the Director of Finance and Information. I really like the comment you mentioned around that financial advice. So we'll take that away and we'll look at see if we can get in a handbook or something together. So from day one, you can have some clear expectations around the simple things like the tax system and little bits like that I appreciate would have made the difference when he came in. But if you don't mind, I was just going to ask Rachel a quick question, if that's okay. So Rachel, from a team perspective and from a sort of management role, is there anything the board can do to support you to provide Khalifa and international recruitment with the best experience that they can have working on our wards?
That's a really good question in terms of what the board can do. I'm not sure, I'll have to give that a little bit more thought, but I think in terms of Khalifa is one of several internationally educated nurses that we've had through the VHAB service, and we've learned continually with each person that's come through and sharing our learning and experiences. Such as what Khalifa's already mentioned, having that protected time, you know, and having opportunity to factor that in to a working week is really important, and making sure we have the ability to prepare our staff as well as possible, with not just internally with LPFT and policies, procedures and expectations, but also the external side in terms of CQC, which is a whole new way of kind of preparing and understanding how that system works. So I think it's creating opportunities, creating space, which we would value above anything, so that we can give Khalifa and our other international nurses the opportunities to meet their needs and their expectations, because they certainly come with the LPFT values and work ethic and a role model to everybody. So if we can harness that and you know, and do our best, that's absolutely brilliant.
Excellent, thank you.
Thanks, Mark. Rachel, I ignored you at the beginning, but it wasn't intentional. I'm really grateful to you for coming along with Khalifa this morning, and to both of you for giving up your time. Rachel, I am, as Mark said, really grateful to you for supporting Khalifa and her international recruit colleagues. You've done a really excellent job, for which I'm really grateful. And Khalifa, I can't wait to meet you face to face. There are lots of other things I'd like to talk about, but it feels a bit like 20 questions at the moment, so we should let you get on with the rest of your day. It's been an absolute privilege to hear from you, and thank you very much for giving up your time this morning.
Thank you so much.
Thank you, everybody.
Thank you.
Bye-bye.
Right then, colleagues, let's carry on with the rest of our agenda. We've got one apology for absence from Medical Director Girish Kunigiri, and we welcome Jazz Full representing him this morning. Has anybody got any declarations of interest which are different to or in addition to those otherwise declared? Yeah, I'll come on to that in a second, Sarah. If not, let's move on then to the minutes of the last meeting. Has anybody got any comments on points of accuracy or matters arising? don't see any. So are colleagues happy for me to sign those minutes as an accurate record of our previous meetings? Excellent, thank you very much. Let's move on then to the schedule of actions. Which are self-explanatory. Has anybody got any comments or questions that I'd like to ask about the schedule of actions? No, I don't see any, so we'll move on then to item 1.5, which are a couple of remarks from me. I'll keep this brief. First is to welcome Sharon Harvey to her first board meeting. Sharon, it's an absolute pleasure to have you on board, and welcome. Looking forward very much to working with you. And then a couple of other, kind of parish notices, if you like. The first is that as a board, we're continuing to do a lot of, I think, really innovative and exciting work to develop the Trust's strategy for the future, and hope very much that we'll be able to have that in a form very soon when we can start to socialise it with wider stakeholders. So really looking forward to that. And then a couple of acknowledgements. First, to acknowledge the continued effective and hard work done by the Trust staff in what continue to be, and it's almost becoming a cliche, but it doesn't make it any less true, what continue to be challenging circumstances. And then secondly, to acknowledge the work of the executive team, the executive members of the board, who I know have been working exceptionally hard in what are difficult system circumstances with industrial action by junior doctors, operational pressures across the NHS system. So on behalf of the board, just want to say thank you to our executive colleagues for continuing to pedal just as hard as they are. That's it in terms of my brief comments. So unless anybody wants to question me on anything, I'll hand over to Sarah Connery for the Chief Executive's report. Sarah.
Thank you, Chair. So morning, everybody. I'm Sarah Connery, Chief Executive here at the Trust. And before moving on, I do just want to reiterate massive welcome to Sharon Harvey, who's still not actually properly started with us yet, so on a phase starting. So and already making some real positive changes at the Trust, some of which we'll come on to in the report. But just a massive thank you to all of my executive colleagues who are going at 150 miles per hour. And it's been quite a challenging planning round in terms of lots of moving parts all at the same time, in terms of what's happening nationally, regionally and locally as well. So to bring it all together into a cohesive, collaborative and triangulated plan is no mean feat. So I just want to say a big personal thank you to everybody for that. Quite an extensive report this month as per usual, which and it doesn't actually quite cover everything that is going on in the Trust and locally and regionally and indeed nationally, but hopefully that you find the report useful. I won't go through it in detail, but I did just want to point out on page 1 around the launch of the Mental Health, Learning Disability and Autism Inpatient Quality Transformation Programme. So this is a national programme that's been instigated, and it is supported by £36 million worth of investment over a 3-year period. So we're on the back of the Panorama programme around Edenfield. We've obviously got our own group with terms of reference set up, and the board, we're keeping the board appraised through the quality committee on that. I do just want to promote to yourselves a dispatches programme. which was on last week, Channel 4 programme on autism in inpatient services as well, which I think is well worth a watch by all the board members. So as a result of that, we're just making sure that really coming at our programme through a lived experience lens, making sure, for example, that we've got lived experience through all of our 15 steps visits, as well as mock CQC inspections, making sure that we're coming at things through an autistic person lens as well, and just continuing to challenge ourselves. So more to come on that through Quality Committee, and Sharon is leading on that piece of work. A massive thank you to everybody who's involved in the Junior Doctors Industrial Action. It was really well planned out. A massive thank you to Jazz and the medical HR team. So I think it was a challenge, but I think we got through it with as little disruption as possible. But now planning for the April 96-hour strike, and really hoping that we can have as little disruption as possible should it go ahead. Ops Courage, so we do take on that leader provider role from this Saturday, from the 1st of April. So there's been lots of planning work going on around that. I've also included in the report updates around our temporary closures and all the various consultation work that is going on there. I also just want to end on a positive note around celebrating success. So we've had some really great CQC inspection reports for our Future for Me service, where we work in partnership with children and young people with complex needs, and also our Lincolnshire Secure unit as well. So we cover the holistic healthcare for young people in that unit, and they were rated good by a joint CQC and Ofsted inspection. So a massive thank you for the teams for all that they do. So I'll stop there, Kevin, and I'm happy to take any comments or questions.
Thank you, Sarah. Thank you very much for, as you say, a characteristically comprehensive report. So I've got a question from Sharon Robson. Sharon.
Thank you. I'm Sharon Robson, non-executive director. Yeah, thank you, Sarah. As usual, it's a really clear report. I just wanted to check on item 5, which is the temporary closure of the psychiatric intensive care unit, that alongside the work taking place there, consideration is being given to the equity of services in terms of the provision for women across Lincolnshire or for Lincolnshire.
Absolutely, Sharon. And if you look at our activity currently, the need is actually more for female PICU than it is for male based on the current numbers. So obviously, with such a specialist services, the numbers do fluctuate. But our ambition remains to have a male and female PICU provision within the county. So as a result of the engagement exercise, we're taking all of that feedback into our future plans to make sure we can achieve that ambition. So yeah, thank you. Good challenge. Thank you.
Thank you, Sarah.
Thanks, Sharon. Di.
Thanks, Sarah. Really interested to hear about the mental health, learning disability and autism transformation programme, not least as the non-executive director with responsibility for chairing the Quality Committee. And that just made me wonder, because really every conversation that we have about quality of patient care at the minute links into our people agenda and our workforce. And I just wondered whether you'd got any early thoughts maybe on how the Mental Health, Learning Disability and Autism Workforce Forum in the Midlands might link in with some of this work, really.
Yeah, absolutely. It's a really great forum to come together and share the learning on those current issues. So we have already talked about what is our training needs analysis. I'm sure we'll come on to it as well in terms of our people committee annual review, and sharing that on a wider footprint as well. So as well as looking at things on a Midlands footprint, we're looking at things from an East Midlands Alliance footprint in terms of sharing resources around those training needs as well. We've done a lot together, for example, around healthcare support workers training and development. And beyond the trust, when we work together with partners, it does attract capacity and resources as well. So it is in our best interest to make sure we keep those conversations going, to tap into regional funding while we're on this journey. So it's not a defined link at the minute, but the touch points are there, I suppose, so that we can share learning resources and best practice.
Okay, great, thank you.
Thanks, Di. Don't see any other questions or comments for Sarah. Sarah, thank you for, as I say, comprehensive report, which kind of deals with the questions before they're asked. So well done.
Thank you, Kevin.
Let's move on then. I should have mentioned when I took apologies that we also have apologies from Jenna Davis, the Director of Corporate Governance. So I'm not clear as a result who's speaking to the next item. Karen, are you stepping into the breach on this?
Kevin, thank you.
Okay, go ahead. The floor's yours.
Thank you, Chair. So good morning, everybody. I'm Karen Scott. I'm the Head of Corporate Governance, and I'm presenting the Board's Assurance Framework and the Organisational Risk Register this morning. So I'll take the paper as read, but I will just highlight and draw the Board's attention to a couple of points, specifically about the risk register. Just an apology that at very short notice we reissued a revised version of the register, and that was just to update a number of target dates that had inadvertently been missed, and they have since been updated. So it is just a slightly different version. In terms of the actual risks themselves, of particular note is following the January's board meeting and the board's challenge, we have re-added 2 risks, risk 18 and risk 209, and they now appear back on the register. In terms of the board assurance framework, there's a lot of work underway currently, which the board is cognizant of in terms of revising the format and template for the board assurance framework. And that's in line with the timescales for the relaunch of the trust strategy. It's to further strengthen and address some of the recommendations that came out of the internal audit report, which the audit committee reviewed in January this year. And at the recent extraordinary meeting of the audit committee, it reviewed that revised template and commented on it and approved it in principle. So work will continue to actually launch that, as I say, in line with the trust strategy. In terms of the board committees reviewing each of their own sections of the board assurance framework, that continues to be done at bi-monthly meetings. And I just wanted to specifically mention that given the high risk, ongoing risks regarding workforce, the People Committee continues using its deep dive process to interrogate those workforce risks. So other than that, I'm happy to take any questions and field any specific queries about risk to the risk owners. Kevin, thank you very much.
Thanks, Karen. Questions or comments for Karen? Di, I think, yeah, Di. Di, we can't hear you, sorry.
Sorry, Kevin, Di Bailey, Non-Exec Director. Karen, I just thought when I had another look at this, we talk about how we use research, particularly to inform mitigation or our actions in the quality section, but I did think that we could perhaps look at it again in terms of some of the other sections of the risk register, because I think we do use research in other ways and we're perhaps just not recognising that in the documentation. So I think it might just be helpful to have a look at it from that perspective. That was my only comment.
Di, I'm more than happy to raise that with each of the committees when they next review their section of the board assurance framework. I think it's a really valid point. Thank you.
Thanks, Di. Sharon Robson.
Yes, thank you. Karen, mine was related to psychological safety and the just and restorative culture, which is 9.22 on the BAF. And the additional action really focuses on policy and the review of policies. I think, you know, I want to kind of challenge that, but it's not for you to address. I think probably the People and Quality Committee have some work to do around that, because it's not just about the policies, you know, just culture is about attitude as well as structural issues. So I'm kind of disappointed with the additional work that's represented within the BAF there, and I would hope that, you know, between the People and Quality Committee we can look at how just culture can be rolled out in different ways in terms of, you know, culture and values of the organisation, etc. So it was just to pick up on that action. I don't feel, given that, you know, the staff survey is showing that staff, there's a decline in the number of staff who feel able to express concern. I think that needs to be stronger, the actions we take around that. Does that make sense, Karen?
Yeah, absolutely, Sharon. Thank you very much. And obviously, I know that both Tim and Amy will be listening intently. And at the next committee meeting, which will be in May, we'll ensure that that's given some further consideration. Sharon, thank you.
Okay, thank you.
I think though, Sharon, if I've understood you correctly, this is not just a people committee issue. It's people and quality.
Yeah.
We've lost you, Sharon. Sorry, you've gone quiet.
I'm having trouble with my sound. Yes, absolutely. I think it's a cross-committee issue, and as a member of both those committees, Karen, I'll work on it as well to look at picking up a bit more richness in terms of the actions we need to take as a trust.
Thank you, Sharon. Sorry, I missed quality. I didn't, and it was inadvertent, but we will make sure across the committees that actually we factor in that just culture. I think it's really vital. Thank you.
Thanks, Sharon. It's a really important challenge, that, because I think it's really important that we don't reduce achieving a just culture to a set of processes or training, because it's much more than that. Tim.
Yeah, thanks, Kevin. Yeah, and agree with the comments just made around being cross committee. I've got a specific detailed question, which I think is maybe a conversation outside, which is a board risk around number 18, the nursing vacancy leads, and it's around the target risk level of moderate by 01/09/23, and I probably need to understand a bit more of the context of that, or the it sounds a bit out of alignment with how we're reporting on nursing vacancy risk and levels elsewhere. I can't unfortunately draw up the actual spreadsheet, so I can't go back and look at the I've only got my notes that I've made from that.
Kevin, can I invite Chris in on that one to comment, and if he has any comments specifically?
Of course, do.
Thank you.
Yeah, thank you. Yeah, Chris Higgins, Director of Operations. Absolutely, Tim, and just look at the report that was put into the board this month around various issues. I think it's worth having a look at that target date. I think it's just there's an optimism around that. Probably when the risk was set. So absolutely, I'll take away and have a look and make sure it aligns with the work that we're doing around the People Committee.
Thanks, Chris. Thank you, Tim. Sarah.
Yeah, so, sorry, it's slightly going back to Sharon's point, but I think it's a really good challenge, and I'd just reiterate the point. This is for all of us. It's for the board. It's not just for committees, and we've had those conversations in the executive team. We had a full-on session around what does an anti-racist organisation look like, and it's absolutely beyond policies and procedures. It's about our values and behaviours. So there is working train around that, just to say that conversations are happening about that. That was all I wanted to say. Thank you.
Thanks, Sarah. And then I've got Chris Higgins.
Sorry, Kevin, that was just from that previous comment.
Was it?
On the risk.
Okay. Thanks, Chris. Apologies. Thank you very much, Karen. A couple of really important discussion points in there, which I look forward to being taken up separately. Thank you for that, Amy. It was just noted in chat that we've got a board development session in June, I think, on just culture, so that's really helpful. Let's move on then to item 3.1, which is a highlight report from the Quality Committee. Di.
Thanks, Kevin. So Di Bailey, non-exec director. So just in terms of the documentation that the colleagues are looking at, in terms of the highlights and exceptions of the committee, this was the first time since the COVID pandemic that actually the committee had met in person, and we did that deliberately because we've moved to this new format where we are using every other quality committee meeting to undertake a deep dive into an area which we've identified as a quality improvement priority. And this one was around our support and involvement of carers. And I think just to follow on from the previous conversation about the just and restorative culture, certainly the conversation that we had about carers' involvement was very much rooted in a cultural change that we wanted to support throughout the organisation. What was interesting about that was that we had in attendance 3 of the divisional leads for quality, and what was interesting was that they were able to give an operational perspective to the strategic conversation we were having about carers' involvement. And what became apparent from that was that things were happening in slightly different ways across the organisation. But I think what we came away with was some clarity about 3 areas of work that we want to pursue, which is in the documentation that people are seeing. So support to raise carers' awareness, to support to embed that sort of cultural change and involvement of carers in the organisation, and also support for carers who are members of our staff and our workforce and how we support them. So we know we've got some further work to do around outcome measures, and the reason that the documentation contains the outcome measures, Kevin, is because we were asked by the Council of Governors to provide some feedback on the outcome measures for them at the next meeting. So I think we need to refine these a little bit, which we will do between now and then, but they are there. So no more about the deep dive. The other thing just to mention was that we did discuss the report of the functioning of the committee over the last period. And I think where we landed with that again was that we've made some changes along the way in terms of trying to get beyond the reporting of activity to really about the so what question, what difference is it making in terms of quality of care and patient experience. We're on a journey with that, to sort of to use that phrase, and I think we need to do some further thinking across all committees about how we capture committee effectiveness. So that is a work in progress that Jenna is aware of, and I think we will be taking forward across the other committees. I'll stop there and then happy to take any comments or questions.
Thanks, Diane, and really good to see the response to the Council of Governors request around outcome measures. I think that's really helpful. Tim.
Thank you. Sorry, just picking up on the last point from Di. Yeah, absolutely. I think the People Committee also recognised that we need to develop the effectiveness review of our committee beyond the internal look. But my question really was around carer champions, because looking back on the previous staff story, there was big emphasis on actually the role that the carer champion took and how positive that was. My question is maybe not for you, Di, but you may be aware, do we actually have carer champions across all the patches? Have we got any sort of gaps?
I would have to defer to colleagues in terms of the detail, Tim, but we certainly heard from the quality leads and the carer lead who was present in the meeting that carer champions are part and parcel of the culture change that we are embedding. However, I think the conversation that we had was, whilst we recognise that that was really, really important, we didn't want to kind of sort of rely entirely on carer champions, because part of the cultural change is about every conversation that every clinician is having about patient experience involving carers. So we wanted to go beyond that, if you see what I mean.
Yeah, no, absolutely. Everybody owns it.
Yeah, absolutely.
Thank you.
Thanks, Tim. Amy.
Hi, Amy Beaton, Director of People. Thank you, Di. I did pick up on the deep diving into the carers who are members of staff. And on that aim, I did see quite a lot of cross-reference to the People Committee in terms of analysis of data and policies and National Staff Survey results. So it was just whether that there is an ask of the People Committee in part of this work, or whether we just need to do a bit more of a cross-reference in the work to make sure we embed this in the people plan as well, rather than silo in the committees.
Yes, yeah, no, I think you're absolutely right, Amy. In terms of an ask, I think we saw this work primarily as being owned and enabled through the Quality Committee agenda. But I think, again, it's, you know, it's hard to have a conversation about quality without that segueing into a conversation about workforce. So I think inevitably there will be some element of overlap. And I think what you raise is a really interesting question that I think, again, as committee chairs, we need to get our heads around a bit more, because I think inevitably when you do a deep dive in any committee, there are interdependencies with those other committees, and I think it's those areas where we just need to be a bit clearer around in terms of what they are, and also about how we get the governance right in terms of some of those interdependencies.
Thanks, Amy.
Thanks, Di.
Chris Wright.
Thanks, Kevin. Chris Wright, Ned. I just want to support what Di was saying around the deep dive and what it kind of illustrates. And I think we need to read this across to issues of productivity and efficiency. And to Tim's point around it being everybody's duty, that we've got to be careful we're not, given the current situation around workforce, we're not creating new roles in addition to the roles that people are already performing. So we need to be really clear about what people do, what their responsibility is, and that we don't end up diluting current responsibilities by creating additional roles, which might not, in effect, add value to our delivery.
Thanks, Chris. I don't see any other questions or comments, Di. There's a question that the board has to answer, and that is whether we accept the recommendation, whether we approve the committee's annual report, and the recommendation is that we should. I'd be really grateful if colleagues could indicate whether or not they're happy to accept that recommendation. Excellent, thank you very much. Let's move on then to item 4.1, which is the highlighted exception report from the People Committee. Tim Harry.
Thanks, Kevin. So Tim Harry, obviously non-exec director and chair of the People Committee. You've got two reports there, the highlight and exception report. You also have appended the annual committee report, which I'll come back to at the end for hopefully formal approval. Now, on the assumption everybody has read the report, I just wanted to draw out 4 points from the highlight and exception report. The first one was around the staff story, which was about the experience of an individual moving from a clinical to a managerial role. And whilst it was very supportive, there was a statement made by the individual which helped put things into context, in that the individual was saying they've had 3 years degree training to be a nurse, and they had 3 formal days of training to be a manager. Now, it's not as black and white as that, because there's a whole load of other mentoring, support, etc., etc. But there is something around further development of the leadership and culture piece. That we had 2 other substantive items at the meeting. One was around the National Staff Survey. We got that elsewhere on the agenda, so I'm not going to go into detail other than highlighting the one thing, which was that the adult inpatient and urgent care division was below the organisational average in every area, and we think therefore we need to escalate that as a potential area for a deep dive. And that again may be sort of cross committee, because it touches on a number of areas. The second substantive item was around the vacancy dashboard, and whilst we've seen obviously good improvements going in the right direction around vacancy rates and also in the retention rates, we started to look at the longer term trajectory, particularly around nursing vacancies. And again, that's an item that we felt needed to be highlighted and escalated to the board for discussion, particularly in the context of the development of the trust strategy and factoring that in. And I know we're going to have a conversation about that sometime. The only other piece was around the committee were happy to sign off the workforce plan and cycle. That was with one caveat, which was around the further development of the longer term planning, and that will come back to the people committee in the future. So if I pause there for any questions on the highlight and exception report.
Thanks, Tim. I don't see any. Do you want to press on?
I will press on, thank you. So you've got the annual report here. The committee received the report with the recommendation that it provided assurance in terms of effectiveness in delivering the terms of reference. We obviously did that, so it's now here for the board to likewise have and hopefully approve. I think in summary, we can demonstrate that we did have effectiveness against delivering the terms of reference, but as in everything, there are areas for improvement. I would also say that I think this last year has been a period of change for the committee. We've obviously got Amy as the new Director of People. The agenda form has changed to get a focus particularly around the 4 pillars of the people strategy, greater awareness of the cross-cutting committee issues, and a greater maturity of the data being provided, in particular around recruitment and retention. So I think bearing that in mind, hopefully the committee will accept the report and approve it.
Thanks, Tim. So the question is whether or not colleagues are content to approve the annual report of the People Committee. So if would indicate whether or not they do. Yeah.
Kevin, if I could just make one further comment.
Well, if you could just bear with me for half a second before you do, Tim. So colleagues are happy to approve the recommend the annual report. Sorry, I'm losing the ability to speak. So back to you, Tim. Sorry.
Yeah, sorry. It was just one quick comment, Kevin. I forgot. I think potentially there was a risk with the committee because of the significance of the recruitment and retention risk that we lost sight of other elements around the people agenda. I don't think we did, but it's something that we just need to bear in mind. But I think what may happen with time is that there may be greater emphasis on some of those other areas. And I'm thinking around particularly around learning and development, which has come up elsewhere on the agenda.
Yeah, thanks, Tim. I think probably we need to come back to wider people issues when we get to the private board a bit later, particularly under the vacancy and workforce planning item on the private board agenda. When we get to that, I'd like to open it out a bit and have a slightly broader workforce related conversation that also brings in some aspects of the staff survey. So I think you're right, Tim, we do need to have that wider conversation. But I don't see any more questions or comments on your report, Tim, so thank you very much. And we'll move on then to item 4.2, Amy, the staff survey results.
Thank you, Kevin. So Amy Beaton, Director of People. Take the paper as read by the board, and as Tim has said, there was a deep dive into the People Committee early this month, whereby discussion took place around the key messages and the actions to be taken. Just to pull out a few points, I think we do need to acknowledge we've seen a dip in our response rate and our results as an organisation when compared to last year, 2020-21. We're still higher on both PICA, which is the provider of the National Staff Survey, and the national average, but we're not where we want to be as an organisation, dipping. So this year, one thing I would like to highlight is we have built a Power BI app, which essentially means we can split the data more and really drill down into identifying where our issues are. PICA is only able to provide the data at an organisational level over the last 5 years, and so what this Power BI app does is it enables us to get that down to a divisional and team level, and that provides us with insight really, and potentially to view results that previously I would say had got hidden. So we will be looking at that resource really to be looking at that data, sorry, to really drill into our action plans and where we need to focus to get the greatest impact. The paper does highlight some of the action areas that we're looking into, and just to bring to board's attention, as Tim has highlighted, we have seen that our adult inpatient division does show results that are much lower than the organisational average. And what's more, now we've got that data intelligence, we can see that across a 5-year trajectory, which we haven't been able to previously. So we can see that that is a bit of a deteriorating picture, and hence the paper does highlight that whilst divisions and directorates will continue with their that level of action plan at an executive level, we have had a conversation around a service improvement project into the division, and we've also linked with another organisation that whilst also sees their adult inpatient results lower than their organisational average, they have got higher results, and so we are keen to learn. The People Committee has also requested a deep dive, as Tim said, on the service improvement project for adult inpatient division, and noting, as has already been said, that it spans the agendas for all committees, I would recommend that this comes back to board for assurance as well. Thank you, Chair.
Thanks very much, Amy. I think there are a number of issues in this that will need more than one, bite at, and some of it, again, I'd like to, as you and I discussed, Amy, yesterday, like to fold into the conversation we're going to have a bit later around workforce and the vacancy position. It seems to me that the staff survey is a bit of a curate's egg, isn't it? Some of it's really good, some of it's not as good as we want it to be, and we need to understand the differences. And there's, as you say, there's a significant job of work around making sure that we do understand the differences and we've got the reasons for those differences and that we've got a coherent plan for doing something about it. But I'm going to propose that we park some of the conversation about that and pick it up a bit later under the heading around workforce and vacancies. But if colleagues have got any questions or comments right now, then do please indicate. I don't see any, so thank you very much, Amy. Let's move on then to the highlight and exception report from the Sustainability Committee. Chris Wright.
Sorry, difficulty with technology. Thanks, Kevin. Just some take the exception report as read, but the couple of things I want to refer to. Firstly, the committee membership is relatively new. There's some new NEDs on the committee, and we're busy establishing ourselves as a committee. And we did our self-assessment, recognising some of the limitations of the quantitative nature of that self-assessment. So we're going to be doing some work taking the lead of the Quality and People Committee, and spending some time thinking through how we can function more effectively as a group. So that's one area where we're focusing. In terms of issues to bring to the attention of the board today, couple of things really. One, we did highlight one, and it's in the report, but we highlighted one of the risks in the organisation around our contract management capability, and so we'll be focusing quite heavily on that. And we've got some new people in the team, and there's an enhanced focus on how effective we are around both management, monitoring, and the whole procurement of activity. The third thing I'd like to say is around the mental health investment standard, and one, our own inability to spend our share of that this year, and that does relate to the whole debate around workforce development, but also the fact that the wider system failed to spend its share of that investment standard. And that's led to a conversation about how we unlock wider capability across the communities of Lincolnshire to support the activity of LPFT and to improve the mental health of our constituents. So we're going to have a deep dive into capacity, wider capacity at a future committee. I think we're having that in June. And then we discussed the budget setting process template, which we're recommending that the board approves, and that will come to the board at some point soon. And then we were delegated responsibility on behalf of the board to sign off the financial plan, and there was an extraordinary meeting of the committee held on Monday the 27th of March to discuss that, and we met and we approved the plan that was put forward. I think that's all I need to say for now.
Thanks very much, Chris. Really welcome the committee's deep dive on capacity. I think that's absolutely the right thing to do, and look forward to seeing some results from that, and I assume coming to board and letting us know what you think. That's really helpful. Any questions or comments for Chris? Don't see any. Thank you very much, Chris. Let's move on then to the integrated performance report. Mark, you're going to take a slightly different approach this morning and run us through it all yourself, so we don't get the 5-part harmony that we've had in previous board meetings.
Yeah, thanks, Chair. So,
and that's why you put it. That's why you put a tie on, obviously, this morning.
This is it. You spotted it. So good morning, everyone. So I'm Mark Platts, I'm the Director of Finance, and I'm here today to present the integrated performance report. As the Chair has mentioned, we're going to do a slightly streamlined presentation on this one, so I will pick up on a couple of the key highlights within the report. So obviously it's important to note, again, a theme through the board discussions today, we are still, as an organisation, operating at high vacancy rates. So within the report, we are reporting 15.9%. However, it is important that we do we do balance that with some positive news and some progression across the services. So one thing I did just want to pick up is staffing turnover rates for February have reduced, and this is the 7th consecutive month that the turnover rates reduced. So some real positive work going on there in terms of retaining our staff, and actually we're at the lowest rates we have been for 18 months. So there is the clear positive movement moving forward, and hopefully 23-24 next financial year we'll see that increase as well. So some great examples across recruitment, across our community mental health teams. So seeing some real positive work locally and across the organisation to bring people into the organisation and encourage them to stay. A positive impact of that from a financial viewpoint is we are seeing a reduction in our agency expenditure. So that's obviously as a consequence of some substantive posts being filled across the organisation. But more importantly, one thing that we do want to note in the report is actually patient safety incidents. Whilst they are kind of higher than we were last year, which is an important point to note, they have reduced again in February 2023. So I think that the continued reduction in turnover, the more effective use of substantive staff, we are really keen to see that continued trend of a positive impact on our patient care. So I did just want to pick up as well, because we did mention that psychiatric intensive care unit earlier on. Obviously, with that unit still being closed, staff have been redeployed across the rest of the organisation, and I think it's important to note on that's allowed other services to have a bit of an increased stabilisation with more staff on the ward providing more care moving forward. So a bit of a link to that is there's a deep dive in the report around patient incidents. So whether that be patient to patient or patient to staff incidents recorded in January and February have actually reduced since the closure of the PQ. So I think again we can see the positive impact on patient care of increased staffing numbers across those units. So whilst it's really important to focus on reopening the PQ and bringing that unit back online, it's also important to note that actually the positive impact that those staff are having across other services is really good to see. I did just want to make a final link to all of that around the vacancies. Obviously, more vacancies than we would like in the organisation is resulting in us spending less cash than we'd planned to. So from a financial forecast viewpoint, we are now reporting an £8 million surplus by the end of the financial year. Now, this is obviously driven by the high number of vacancies, but more importantly, I think for me, we've signed off a plan for next year where we have a much more high degree of assurance that we're going to start to spend that and deliver that next year to improve and build on the positive steps that we've had with the integrated performance report. So I'm happy to take any questions, Kevin, as our colleagues have sort of drawn up the report alongside me, but I'll leave it at that point. Thank you.
Thank you, Mark. That's really helpful. So first of all, from me, really good to see staff turnover rates improving. That's absolutely a positive step, and that's good to note. On vacancies, we'll have a more substantive conversation about this later, but it's important to have in mind the difference between vacancy rates for existing services and for new services, and the headline figure is distorted by that, and that's important to bear in mind. On the financial position, I think that this relates back to the point that Chris Wright, chair of the Sustainability Committee, made a few moments ago about making sure that we have a proper understanding of how we can, or whether we can, as it were, buy in additional capability and capacity to help us to meet both our ambitions to spend to deliver the mental health investment standard, but in a way that maximises the impact across the system on the mental health of the Lincolnshire population. So there's a job of work to do around that as well. Questions and comments for others. I've got Tim first.
So Tim Harry, non-executive director. Mark, thank you very much indeed. I was going to make a general comment about potentially development of the integrated performance report, because I've paid a particular attention. I've read it about 3 times. I think there's an awful lot in there. What you actually just did was started to, I think, give that sort of narrative across the areas, because before, I think, you know, the way the paper's written, it is by that, and you have to do it that way. But actually, perhaps from the board's perspective, it's equally important to understand the sort of matrix, the cross-cutting piece, and by your narrative of what you've just done. So I think personally, it probably doesn't need to be any more than, you know, a couple of paragraphs, but a couple of paragraphs of narrative at the front around looking at the implications across the various areas would actually be particularly sort of helpful. So I really appreciate what you've just done. Thank you.
Thanks, Tim. I think we're going to have a conversation again in private board about how we report and examine performance at board level more generally, and I think we'll pick up some of the observations that you've made in that. Sharon Robson.
Yeah, thank you, Chair. Mark, it's not necessarily for you to answer, but it's a comment about the perinatal service. And I know myself and the medical director visited that service in November, and there were some staffing issues. The metrics around performance, you know, is 7.9 this month, and it is slowly creeping up. So it was 7.4 in December and 7.7 in January. But I would like to see some narrative in the report, in future reports around that service, so we can keep an eye on when we'll get back to a good position. And I think that would be useful for the local maternity system as well.
Yeah, definitely. We'll put that one up, Sharon. Thank you.
Thanks, Sharon. Chris Wright.
Thanks, Kevin. Do you know how some board members will be known for raising the same point at every meeting? Well, in this meeting, I've already raised the issue of productivity. And again, I want us to focus a little bit on productivity and efficiency, because although our financial performance over the last couple of years has resulted in a surplus position, that's largely due to the fact that we haven't been able to spend the monies that have been made available to us, and we've got there's lots of reasons why that is, but we actually also have an underlying deficit in the organisation, and we need to ensure that as we shape our spend, that we're also being very mindful of productivity and efficiency, and understanding what it actually costs to run LPFT, so that we can address that underlying deficit challenge.
Yeah, thanks, Chris. I think there is, and Mark, you can comment on this if you want to. There's an ongoing piece of work to ensure that we've got a sustainable underlying financial position in the future. I'm expecting that at some point to get some scrutiny from the Sustainability Committee, but that's partly about understanding, you know, exactly what the makeup of our current workforce is, our target, you know, kind of post levels, but it's also about understanding better productivity and so on. But Mark, I know you've got that job card now in terms of getting us to a more sustainable financial position, and as I say, I expect it to come back to sustainability at some point in the not too distant future. I can see you nodding, so I'm obviously not
100%. It's work in progress. And I know Chris Higgins and the team are looking at a full demand and capacity review exercise, which does feed through Sustainability Committee. So yeah, I agree with that.
Great stuff. Thanks, Mark. Chris Higgins.
Yeah, thank you, Chair. Just to make a comment, back to Sharon's query around perinatal, we will provide some updated narrative in the next report. It was just to confirm that in the annual plan for the coming year, we have committed to hitting the access target by the end of the year. So we're confident with the plans that we've got online and the work that's going from the service that we will hit the access target for perinatal. But as I say, I'll put a bit more narrative in the next update.
Thanks, Chris. Appreciate that. I don't see any other comments or questions, and I've had my go. So, Mark, thank you very much. I think that worked better, actually. You know, getting that overview from you and allowing colleagues to come in where they needed to come in. So, thank you for approaching it in that way, and thank you for putting a tie on to do it. I might even wear one next time, given the amount of ribbing I've got in chat. I think it's still with you, isn't it, Mark, for item 5.3?
Yeah, thank you very much, Chair. So I'm presenting the it's the biannual senior information risk owner report. So just for a bit of context for board members and the public, this report does now go to our sustainability committee twice a year. So it was an annual report, but I felt it important to give a more regular, timely update to the committee. So the report presented to board today is the summary of the year, the second one that does come through. So I won't go through a lot of detail on this. The report's fairly self-explanatory, but I will just highlight that there is going to be a refreshed data security protection toolkit launched during the summer, and this is a really important toolkit assessment that organisations go through, and it's really positive now that voluntary sector organisations and much smaller organisations are going through it, as well as public sector bodies. So a big focus around the use of organisations' data, and particularly around cyber security. It's a very hot topic at the minute with a lot of the impacts that are hitting the industry and other sectors, really. So I think what I would say is the CIRO for the organisation is LPFT is being very proactive around cyber security, and there'll be more details on that being presented to Sustainability Committee in a couple of weeks in April. So that's an important area that we are focusing heavily on. And I think another one that I do need to be mindful of and just mention to the board again is the ongoing work as a system means that we can continue to have information governance challenges around what level of information is shared with partners and how is that used, and how do we balance protecting patient data with facilitation of greater quality services using more agencies across Lincolnshire. So I think that's going to be an important focus for the coming 12 months, really. But the report here looks at some of the key highlights from the current 12 months. So I just present the board for decision approval of the report. Thank you.
Thanks, Mark. Any questions or comments? Sarah?
I just wanted to congratulate Mark and the team and all the services, in fact, that have supported us hitting that really positive data security training percentage. And as a previous CIRO, I know that is an absolute challenge, so it's a really positive achievement. So I just want to say thank you.
Yeah, thanks, Sarah. Absolutely echo that. Well done, Mark and the team. I think the board has to formally approve the report, doesn't it, Mark? So if colleagues can, yeah, thank you. If colleagues can indicate whether or not they're happy to approve the report, that'd be helpful. Thank you. Yeah, good stuff. That's very good. Thanks very much, Mark. Let's move on then to the highlight and etc. report from the Audit Committee. Ian.
Apologies there, sorry, I was just having a technical moment, sorry about that. Yeah, Ian Orrell, chair of the Audit Committee. Yes, you'll see from the papers that this was an extraordinary meeting. Largely it was one we popped in to cover off what was initially planned to be a couple of audit reviews, which we did cover off the ones on local security management and payroll. But we also on the agenda picked up an early sight really of the revisions that have been undertaken to the BAF, which is part of an ongoing process that the board will no doubt sign off once it's happy with things in due course. So I'll take it that the report was read. The main sort of I suppose message that I would give to people is that these papers were obviously part of our agenda as an audit committee to strengthen trust governance wherever that's possible, and these were more examples of doing that, and we'll continue to do it. So if anyone's got any questions, be glad to try and take them. Thank you.
Thanks, Ian. Any questions or comments for Ian? I don't see any, Ian, and the report, as you say, speaks for itself, so thank you very much. Let's move on then to item 6.2, which, Karen, I assume you're speaking to in Jenna's absence.
I am, thank you, Kevin, and I would have done in any case because Jenna as director is conflicted. So
yeah, of course, you had warned me of that. Apologies.
Thank you. No, that's fine. So thank you very much, Karen Scott, Head of Corporate Governance. Pleased to present the biannual review of the Directors and Governors Code of Conduct and Responsibility documents. These have been reviewed by the Trust Standards Committee earlier on in this month. And there's a number of recommended amendments which are largely, excuse me, administrative, with just one specific suggested inclusion for the governor's responsibilities, which takes into consideration legislation which was implemented last year under the Health and Care Act 2022 regarding their expanded role in representing and ensuring the views of the public at large. So, subject to the board's approval of the recommended amendments, these will then be presented to the Council of Governors at its meeting in May for its support. And then we would expect that the directors and governors would each need to re-sign or sign a version of the revised documents and submit them. Thank you, Kevin. Happy to answer any questions.
Thanks, Karen. There's a question from Tim.
Thanks, Tim Harry, Non-Exec Director. It's just a point of clarification. I think I know the answer. So, yeah, fully support all the changes. Presumably there isn't an equivalent change in the Code of Conduct for directors because there isn't something that has changed in the legislation. So that's why it's there, because otherwise you might have expected some equivalent sort of phrase in the Code of Conduct for directors in light of the ICS and looking on the broader picture.
Absolutely, Tim. No, there hasn't been anything specific. It was very specific guidance and recommendations based on the Act from NHS England with regard to the governors, but not specifically the directors. But we would have incorporated anything that came out of that if there had been.
Thanks, Tim. We need to approve both documents, don't we, Karen? So if colleagues could indicate whether or not they're happy to approve the proposed amendments. Fab, thank you very much. Let's stick with you, Karen, for item 7.1.
Thanks, Kevin. This is just to note it's the board's programme of future meetings. One specific change that I want to just highlight is the first item in the list, which is the rearranged Sustainability Committee meeting, which is taking place a week later than previously scheduled. So other than that, just to note, thank you, Kevin.
Thanks, Karen. And then the final substantive item for this morning is item 8.1, Mark, budget setting policy.
Excellent, thanks, Chair. And Chris Wright mentioned this earlier on. So this has been reviewed by the Sustainability Committee and is here for formal approval. It's an important document that remains reflective of how we can effectively manage our budgets. So happy to take any questions on it, but it's here for approval.
And I assume, Mark, that approval is recommended by the Sustainability Committee.
Yeah. Apologies.
Okay.
Yeah.
Any questions for Mark? I don't see any. Our colleagues happy to approve the amendments to the budget setting policy. Fabulous. Thank you very much. I've not been notified of any other business, and I don't have any other business. So I think we're about complete. Thank you very much, everybody, for your input and attention this morning. I think we've heard a really important staff story right at the beginning of this morning's board, with a number of, I think, suggestions that we'll want to follow up on. If for no other reason, I think this morning's board meeting was well worthwhile just to hear that. So I'm going to suggest that we reconvene in half an hour at 11 o'clock to give people a chance to stretch their legs and get a cup of coffee and whatever. So we'll get back together again for private board meeting in 29 minutes by my clock. So see you in a bit.